Hello students, and welcome to your pathology class. My name is Christy. I'll be your instructor for this course. I'm going to go through a couple things here online that are really important that you pay attention to. My name is here along with my phone number. You can call me. This line does go straight to my cell phone. Best thing to do is send me a text message if you can. This is my email. Contacting me through email is great. That's the fastest response typically. I am here on campus typically Monday through Thursday, 10 to 12 hours a day. So if you're here on campus, just swing in, come say hi. If not, if you're not at the Sacramento campus, feel free to contact me anytime. I will get back to you as soon as I can. If you need to talk to me, we can do some kind of conference call so I can explain things to you as needed. Your syllabus is here, and I'm going to go ahead and pull it up. We're going to go through it real quick. Here we are. And here is your old one, new one. Here we go. This is just updated. As you can see, it's 36 clock hours, so it's equivalent to 3.5 quarter credits. This is completely online, and you can do your homework assignments and coursework at your leisure, which is awesome. You'll have discussion board posts, pathology assignments. You're going to have to go through the PowerPoints along with read the book. You'll have a quiz every week. There's a lot to it, so make sure you stay on top of it. It's easy to fall behind. If you are stuck and you can't get Moodle to work for you, you're going to contact Jelena or Chris Peppers. They will be there to help you. And you're going to take this course concurrent with your other courses. So we are going to go through the different organ systems in the body, and we're going to talk about the different pathological conditions that come with those. Very, very interesting. Like I said, it's a lot of work, but it's really interesting and makes the job a lot more fun when you actually are in there scanning and you see some of the pathologies. It makes it very exciting. So you're going to state pathologies commonly require MRI. This display understandings of signal characteristics displayed by abnormal tissues during various pulse sequences and imaging modes. You are also going to take a look at X-ray, ultrasound, nuke med, and CT and find their strengths and weaknesses in addition. So you're going to recognize changes in anatomical size and shape of structures, which could indicate pathology. Really important when you're scanning to be constantly looking for pathologies. You're going to describe pathological process, and you're going to identify the nature and course of pathologies. You're going to describe the impact of contrast agents in visualizing pathologies. Your textbook is listed here. You should have it, and you have to do all the work in this course. If you miss any quizzes or assignments, you're going to have to make up all that work, and you're going to have a deduction in your grades. So don't miss anything. Just do all the work. Get it done. All right, so all exams are done online and they're timed. What I do is I give you 2 minutes a question, which gives you enough time to read the question and answer the question. It doesn't give you much time to look it up. So if you've read and you've made notes and you've outlined the chapter, you're going to do just fine. You should pull off an A, no problem. But if you have not read and you're going to try to do the quizzes, I'll be able to tell because you're not going to get a high score. You're going to get a low score. So make sure that you prepare because you know, it's always nice to get A's. All right, here is your course schedule. We're going to fly through it. So we're going to start off with your Intro to Pathology, Chapter 1. Then we're going to go to Chapter 2, which is skeletal, Chapter 3, which is respiratory, 4, cardiovascular, 5, the abdomen and the GI system, and 6, hepatobiliary, 7, urinary, 8, central nervous. We have 9 and 11 I put together. They're smaller chapters, and there's not a whole lot that we cover in imaging. So there's the hemopoietic and the endocrine system. Then we're going to go to Chapter 10, which is reproductive, and Chapter 12, traumatic disease. So if you look at each one of these weeks and you can see we have 11 quizzes. So one for each chapter except when we go to, well, not each chapter, one per week. So I combined these two, the hemopoietic and the endocrine, so it's just one quiz. Then if you notice, there's no midterms, there's no tests, it's just quizzes and then the final. And the final will be cumulative. Now the smart thing to do, and I'm going to warn you now, is to go ahead and outline all of your pathologies as you go. Very, very important. So when you get to the final, you're going to have about 200 questions and you have 2 minutes a question, which isn't going to give you much time. So really important that you outline all your pathologies as you go. It'll make it a lot easier. Okay, my grading system. So your homework assignments are 30%, your discussion forums are 10, your quizzes are 30, and your final is 30. So each week you're going to have to do a discussion and on something that we're studying. So if we're doing the skeletal system, you're going to find a pathology that you saw when you're scanning in clinic, and you're going to talk about it. What were the signs and symptoms? How was it, the patient presenting to you? And you're going to write about it, and you have to respond to someone else's also. And the directions are pretty clear. And our normal grade scale. So if you have any questions, here's all of the links to our catalog for academic. So big thing here, academic integrity. This is an online course, so it's really, really important that you guys do your own work. If you are suspected of cheating, it will be a problem. If you are caught cheating, it's a bigger problem. So you don't want to be dismissed out of the program for cheating in an open book, open note test. So don't do it. It's not worth it. Okay, so back to your class. As you can see here, the syllabus is loaded for you in a PDF. You have to agree to the syllabus in order to see the courses. As you can see here, I have them all loaded. All 12 weeks are here for you. You are not going to be able to see all of these weeks. They're going to be hidden from you. So don't be alarmed. They're all there. They're timed on their opening. So here's your first week. It's Intro to Pathology. And we are going to have the PowerPoint loaded here for you. Here's your quiz, your discussion board post, and your assignment. So when we look at the pathology assignment, let me just go over that right now. What I want you to do, if you click here, it's going to give you the directions. So it says one paragraph. Now, when I say a paragraph, I'm not kidding. I'm not talking about 10-page assignment. I just want you guys to write up real quick the following. I want you to list the patient's symptoms, list any findings on imaging, and the best imaging modality to see the pathology. And you can copy images from what you are pulling the information from and put it into your paper, which is really nice. I want you to list the differential diagnosis. I want you to list what the actual diagnosis is and the key points for that pathology or the pathophysiology of the disease. Common treatments, and list the prognosis of the disease. So what is going to happen to this patient? What's their next step? Is it biopsy? Is it chemo? Is it not treatable? So I want you to use the websites that I have listed here. Now I say that because I know that these ones are good. Now Aunt Minnie Case of the Day. So Aunt Minnie, you're going to have to log in. You're going to have to get a log on. It's free. There's really cool cases. There's always a case of the day, and you can go in and they're going to ask you questions. What do you think this is? What do you see on this sagittal T1 of the brain? What looks abnormal? And then you're going to guess multiple things on what you think it is. Now, these are the strange, odd cases. I don't expect you guys to get these right first time. You may not ever get any of them right, and that's fine. It's no problem. What it's going to do is going to teach you to look at MRI images, CT images, ultrasound images, and nuke med along with radiography. Be able to look and see what the different pathologies look like in each modality, and it's going to describe all the pathologies, everything that I'm asking you. So you can do, you can view different cases. Here's 3 more. So every day they list typically 3 cases a day. So you can also go in and just click on view more cases, and you can go by organ system, which is really nice. So there's Aunt Minnie. I love Aunt Minnie. She's my favorite. I'm sorry, but you guys, she's the best. And then there's Radiopedia. This one is a great site also, so you can come in here and you can look at different cases and you can filter by organ systems also, which is a lot of fun. And yeah, so it's going to ask you questions also. I've always used that many, so use what you like between the two. There's also this Internet for Pathology laboratory for medical education. Now this takes the pathology a step further. You can look at the site, play around with the site. It's interesting. So if you found something really fascinating, you can click on that and you can go deeper into the pathology. But I wanted to put that there for you just in case you're interested. There are cases in there that you can use. So each week there is this exact setup. So you'll be able to go week to week to week to week. Your discussion board post. Let me get this to open up, maybe. Discussion. Doesn't want to talk. Okay, so here. Please share with the class a pathology you witnessed in the clinical setting. Please define the pathology and the signs and symptoms the patient was complaining about. The pathology can be anything for this week. So you're going to respond to also your classmates. So please respond to one of your classmates posting, adding any experience you had with the pathology, and if you ran any special sequences to see the pathology better. If you have never seen this pathology before, look up the pathology and add something that your classmate might have missed that you found interesting about the pathology. I'm not looking for a research paper here. I'm just looking to see, hey, have you seen this? Oh, we did see it. We actually ran thins of whatever, a stir, whatever, through that pathology to get the characteristics. So that's what I'm looking for. I'm looking for your response. So I want you to know, did you find anything? What was the patient complaining about? What did it look like on imaging? Was it, did it fat sat? Did it not fat sat? Was it, fluid all around it? Just kind of give your classmates an idea of what it actually looked like. So as we go through the following week, the second week of the courses, we're going to go through skeletal system. In the skeletal system, you're going to find something of the skeletal system. When we get to respiratory, you're going to do something of the respiratory system. So, and then you're going to respond to your classmates on what you saw. All right. So that's the basics of your class. Every week you'll have a PowerPoint, a quiz for the PowerPoint and the reading. You're going to have a discussion board post and an assignment from either Aunt Minnie or Radiopedia. You're going to put those up. I'm going to grade them. I'm going to put them into Jeji for you. I typically say on top of the grades, it's really important for you to understand that you only have your final. There's only a final. You have quizzes every week, which are 30%, and your final, which is 30%. So don't fall behind and don't get low scores on your quizzes because it's going to hurt. It's going to hurt badly. So I wish you guys all the best in this class. I think pathology is the coolest thing ever, and it's the reason why we do the job. Speaking of that, there's a general forum. I want all of you guys to go into the general forum, and I want you to read what I had to say, and I want you to comment on where you're at in clinic and what kind of scanner you're on and what is the field strength, so that I have an idea of what you're working with, so I can gauge your responses. Okay? Thank you much, and you'll be hearing from me. I will have recorded videos up for you also. All right.